As I answer it, I want to give a caveat. I've been in HIV/AIDS my entire professional career, so I have drunk the Kool-Aid a little bit, so my answer will be directed that way. But I'm also a scientist and come from a scientific background, so I like to look at data and use the data to direct what we're doing. And if you look at the data, HIV/AIDS is a unique disease. Unlike most diseases and other things that unfortunately kill the very young and very old, this is a disease that principally affects 15 to 40-year-olds, kills 15 to 40-year-olds, knocks out a generation of the most productive and reproductive people. And the data are somewhat overwhelming. I mean, if you look at peaks of death in South Africa right now, 25-year-olds are dying at a higher rate than 60-year-olds. HIV/AIDS has wiped out 50 years of public health gains by reducing life expectancy in half in some of the hardest hit countries. Infant mortality, for example, in Botswana, it went up because of HIV/AIDS, despite the government doubling their resources for child survival and health. So HIV/AIDS is a unique disease. It's not like most others. And if we don't get HIV/AIDS right, no matter what we do in development, at least in Africa, we're not going to turn things around. And I think there are simple ways to think about it, really. We're losing a generation in the hardest hit countries of parents, teachers, workers, and peacekeepers. And if you lose those people, you can't develop. And we can look economically. UNAIDS estimates that the hardest hit countries will lose 20% of their gross domestic product because of HIV/AIDS. And while we're seeing growth in economies in Africa, it's being inhibited by HIV/AIDS because you're losing those productive and reproductive people at very high rates. And in fact, the World Bank recently said that while the rest of the world is moving rapidly in development, Africa risks being left behind, and that's because of HIV/AIDS. Additionally, the Millennium Development Goals are heavily in Africa pinned to HIV/AIDS. Again, if you're losing parents, teachers, peacekeepers, workers, you're not going to have development. You know, orphans and vulnerable children is a key area we're working on. So many parents are dying, 14 million orphans worldwide, 12 of them in Africa. We can be to 25 million by 2010. These are just staggering numbers. And we also know from basic child survival and health vantage point that an orphan, regardless of HIV/AIDS status, and we have data now from Uganda, have a 3 times higher rate of death if their parents aren't around, from all causes. So if we're losing all these parents and creating orphans, how are you going to do child survival and health when you have a 3-fold higher risk of dying because you don't have a parent? Teachers. In the hardest hit countries, 1/3 of teachers are dying from HIV/AIDS. We cannot keep up with the teachers to provide education. So you can put all the money you want into education, but if you don't have the teachers, you're not going to be able to provide them with what's necessary. Millions of workers and reproductive hours are being lost to HIV/AIDS, and there's extraordinary data now showing the massive increase in productivity when antiretroviral therapy is available. Peacekeepers. We need peace in Africa if we're going to have development. Peacekeepers are heavily affected by HIV/AIDS. Militaries are 2 to 5 times more infected than the general population, and then when they go out to keep the peace, they have a higher rate of getting infected, so then they come back home at an even higher rate. South Africa recently tried, and South Africa is one of our principal forces to provide peacekeepers, as is Rwanda, as is Uganda, as is Nigeria, very high risks for HIV infection. South Africa recently tried to field a battalion and couldn't come up with an HIV uninfected battalion. People are sick and dying in the military, so we can't keep the peace. And about 37% of all UN peacekeepers right now come from Africa, and that's only going to go up. So it's just basic. If we don't get AIDS right, we're not going to get development right. I think a second important point is that the dollars are having massive impact. We're starting to see the impact of the dollars. So whether it's 20% or not, it's having a tremendous impact. And this is one of the extraordinary things about what President Bush did. He didn't just say we're going to commit dollars. He said we're going to achieve results, and we're going to turn the epidemic around, and we're going to achieve them in prevention, care, and treatment. And already, through March of this year, the American people, you all, through your tax dollars, supported 1.1 million people to get antiretroviral therapy in sub-Saharan Africa. When President Bush announced the initiative, 50,000 people in all of sub-Saharan Africa were receiving treatment. We're already up to 1.1 million in 3 years. We provided care, you all have provided care for 4.5 million, including 2 million orphans and vulnerable children through September of last year. In prevention, we made great strides, reaching 61 million people with prevention messages, and already we've averted over 100,000 infants from being infected through transmission from mothers to children. So the impact has been extraordinary, and it's just going to get greater, and we're seeing the impact overall. Remember, I said in Botswana, infant mortality was going up because of HIV/AIDS. Because of their effective national programs, infant mortality is going back down again. That's basic development. That's basic child survival and health that we're impacting with HIV/AIDS. The other point I want to make is HIV/AIDS dollars actually contribute in significant ways to basic development and child survival and other goals. When PEPFAR began, our entire Orphans and Vulnerable Children program for development was $30 million. Last year, we were $270 million because of PEPFAR. That's basic orphan and vulnerable children care that would classically be considered child survival and health. Those statistics I gave you on prevention of mother-to-child transmission, that's basic child survival and health. So we're actually doing basic development components within this expansive prevention care and treatment program. Another important point there is we are significantly expanding health infrastructure and basic health infrastructure. We just did a survey of 4 countries where we're doing care and treatment programs. 77% of our resources went to build infrastructure, basic health clinics, laboratories, and personnel. We were paying for 30% of the personnel in the healthcare structure in the public and private sector. So our money is going to build basic health infrastructure that has a massive impact. And we now have data on that. There was just a study done in Rwanda on the impact of HIV/AIDS resources on non-HIV health aspects. So in a region of Rwanda with 25 centers, a study was done to look at the impact of an infusion of AIDS resources through PEPFAR on 22 non-AIDS health indicators. 21 of 22 went up, 17 of them in a statistically significant way, 7 of them directly related to the HIV/AIDS resources by regression analysis, including family planning and antenatal care, and another 5 went up indirectly related to AIDS, and the investigators believe they all did, they just didn't have the power to show it. So we're expanding this methodology. Now, that was without trying. We increased all those other health aspects without trying. What we're trying to do under Henrietta's leadership is to try, to put all these pieces together, to put the pieces of foreign development together, to put family planning and basic child survival and health and antenatal care and food programs and education programs, put them together and leverage each other. We've begun to do this in malaria with the President's Malaria Initiative. We're going country by country. We're delivering bed nets through the infrastructure that we've developed for PEPFAR for home-based care. We're adding trying to add neglected tropical disease and other development aspects through the infrastructure that's already been created. So as we try under this new model of foreign assistance to put the pieces together, those data from Rwanda on increasing the health system with HIV/AIDS dollars will just grow. So I think it's an important question and one we need to be very attuned to and watch very carefully and ensure that we're not harming the health system. But it's pretty clear right now that we are dramatically improving the health system. And the Institute of Medicine said that when they reviewed PEPFAR. It said we are absolutely increasing the health system. So we just need to be careful and plan well and strategize well, but that's why we have a Director of Foreign Assistance. But it's an important question. I look forward to hearing what your all thoughts are on this as well.
Terrific. Thank you. Now let me turn to the Millennium Challenge Corporation, Ambassador Danilovich, and ask you, this is an experiment that has been very closely watched on the Hill by experts as one that may be rolling out best practices in many respects. I think there's a lot of appreciation for the transparency and the accountability. But as you know better than anybody else, there's also a lot of skepticism on Congress because the money has not moved quickly. And so I'm sure you've spent a lot of time responding to that critique. How do you balance that desire to do things fundamentally different with the need to show results and to move money quickly?
Thank you, Lael. And thank you, George, also for being the organizers of today's event. It's a pleasure to be here. I'm also surprised to hear that it's the first time 3 of us have been together on the same panel. I'm surprised because actually we do see a lot of each other. We talk to each other. We strategize. We actually like each other. And the fact that whether it's 16 or 18 months left on the administration, depending upon how you do your arithmetic, I think this is probably an expression of security in numbers as we get near the end of the administration.
Well, maybe because you like each other that nobody's ever asked you to appear together.
Thank you, Lael.